Doctors of Reddit, what's the most incorrect patient self-diagnosis you've seen? Late to this, but my friend has an incredibly tough, alcoholic grandma. She ignored a stroke because she thought it was a hangover. Damn, that grandma must have had some rough hangovers. Late to reply, but my grandma toughed out 3 mini strokes because she thought they were migraines. Old ladies are tough. Saw a patient last night who had been having episodes of wind for 6 months and had come in because of a particularly bad bout. Massive heart attack with crescendo angina over the preceding year. Not that uncommon a self-misdiagnosis, but kind of takes you aback when you see it. Fart attack. My boyfriend had the opposite, thought he was having a heart attack. He was 20 SMH, just needed to fart. Not a doctor myself. My grandfather was a doctor and had a patient come to his office complaining of a slight headache. His receptionist told him to wait in the waiting room. They called his name, but the guy never came up to the desk. He actually suffered a major brain hemorrhage, died waiting to be seen in the chair. Damn, that sucks. So close to help yet so far away. Man who rode his bike as sole method of transportation came in for chronic knee and leg pain. He had metastatic prostate cancer with bone lesions all over. Came in for my legs hurt, left with hospice referral. I really hope you are an actual MD with a screen name of banana balls. Dad went to the doctor for a nagging pain in his backside. Ended up being diagnosed with stage 3 metastatic prostate cancer. Cancer was throughout his rib cage and liver, which was causing pain. He valiantly fought for 3 years, but the cancer won. Sad. As a paramedic, I responded to a dispatch for a sick person. When we arrived, this old guy was clearly having a stroke. He said I just ate some bad fish or something before taking a 3-hour nap. Luckily his wife finally decided to call 911. That would have made a funny tombstone though. I just had some bad fish or something. Looks like my grandparents now. I just ate too much. I don't need a doctor. Hospitals are free in France. Some doctors can come to your house too. This thread is like reverse WebMD. Think it's cancer? You just stubbed your toe. Think you have a cold? 100% cancer. I'm kinda hungry. How long do I got, doc? Not a doctor, but a psych first responder. Patient self-diagnosed as dead. EMTs didn't believe him. He was quite insistent though, and wanted an ambulance ride because he thought a dead person ought to have one. The EMTs argued with him, stating that he was both standing and talking. He countered that he was in hell. In fact, he was just pretty high with a bad drug combination. I had a fun hour with him while he came down. I have schizophrenia and I have thought I was dead before. It's very hard to stay at work when I think I'm dead, because why would I work if I was dead? Patient self-diagnosed as dead. This is by far my favorite response in this thread, and the funniest thing I've seen all day. As a medic, I had a soldier run up to me and demand to see the PA. When I asked why, he said his girlfriend has BV and now he's sure he does too. I assured him that he most certainly did not have bacterial vaginosis. Edit to add a note, the soldier in question was symptom free, and we definitely still let the soldier see his provider. How do you know that? I'm not a doctor, but I am a medical professional at a hospital. Patient came in stating that he had blood in his stool for almost a year and was convinced that it was just because of hemorrhoids. He only came in when he started to get abdominal pains. Turned out to be colorectal cancer. Moral of the story is, if you have blood in your stool, especially dark colored, don't ignore it. Doctor here. Any blood. If we could tell the difference between cancer and non-cancer by the color of the blood, it would make our lives a lot easier. And yeah, most of them aren't cancer, but a few are, and those are the ones we need to find. I have had an unbelievable amount of patients who think they have Stevens-Johnson syndrome. Thanks WebMD, when they in fact have contact dermatitis from new lotion or laundry soap. I also advise not looking up that condition. Edit. If you have recently started lamotrigine, carbamazepine, Bactrim, or allopurinol and develop a rash, definitely call your doctor. It may actually be SJS. For anyone curious, SJS basically makes your skin fall off. 10/10 would not Google again. Have a friend who wound up getting SJS. Definitely do not recommend looking that one up. He had to have his eyelids sewn shut for duck's sake. Nice. Please smash the subscribe button to enjoy daily askreddit content. Elderly man with dementia brought in for suspicion of toxic epidermal necrolysis, a serious and life-threatening reaction where your skin peels off in sheets. Nope. It was a very large burn because they left grandpa alone at the house and he spilled a teapot on himself and the family, and another hospital were too dumb to figure it out. Tale as old as time. If I had $1 for every patient who thought dermatitis and laundry soap was SJS, I wouldn't even have to work anymore. I was rushed to the ER as a kid because I woke up and my face was blue. Obviously my parents thought I wasn't breathing. I'm 8 or 9 years old, and everyone's sudden change in demeanor is making me a little scared, and I'm just getting bluer. At Emerge, they're running all kinds of tests that aren't showing anything wrong with me, until finally my dad realized that I put the brand new Toronto Maple Leafs pillowcase I just got on my pillow. Washcloth later, I was all better. At least it was a really nice blue. Being a Leafs fan can make you feel pretty blue in other ways. He had some belly pain and thought he had a UT. Also had weight loss, night sweats and some other stuff. He had terminal pancreatic cancer and 2 weeks later he is delirious and at death's door. I want to upvote you and downvote the cancer. I'm so sorry. Oh man. I'm so sorry. Not a doctor, but I am a nurse. I recently had a patient who claimed that he used to have diabetes, but Jesus cured him of it. His glucose was nearly 300 on admission and he was in the hospital for an amputation of a gangrenous toe that didn't heal because of said diabetes. I'll never forget the doctor's note that said patient had a history of diabetes but states Jesus healed him of that, but since his blood glucose was 289 on admission we will treat him as if he were a diabetic. America, we need to talk about this religion thing. Beginning to think you have problems. Call me. When I was 15 my mother was absolutely convinced that I had Bono. http://www.webbed, guides TC infectious mononucleosis topic overview. As I was coming home from school and sleeping for several hours, eating dinner then going back to sleep. So, she took me to the doctor who did an evaluation. It turns out that I didn't have mono. I was just lazy. Side note, this period of laziness was only a few weeks after the conclusion of varsity swim season, so I was naturally exhausted from months of training. I once thought I had mono for an entire year. It turned out I was just really bored. Go to tell the families that. Not a doctor but is somewhat related. This one night I started getting some excruciating cramps that were so bad I had to wake my mom. She asks me where the pain was and I pointed out the right side of my stomach and instantly she tells me to get in the car and we go to the ER. She thought I had appendicitis. We get there. I'm hooked up to morphine and they get an x-ray. I didn't have appendicitis. I just had to shocks real bad. Know two people, a good friend and my sister's fiance, who complained of backaches, like they pulled a muscle. Pancreatic cancer went from pain to them passing away in less than 90 days. Edit. Thanks to everyone for their stories. All of them bring back both good and sad memories to everyone else. If you have a pain that just doesn't feel right, go see a doc. We want you here. This thread is giving me paranoia. Wait, what? I have back pain. I once thought I had a perforated colon because my poop was bright red. I spent an hour on the toilet in pain googling symptoms and then I remembered I got high the night before and crushed a bag of flaming hot Cheetos. You swear you're shoxing out your intestinal lining, then realize it matches your fingers. Okay, so why do you think you have glaucoma? Well, back in 2002 I got shot right here, and it was a Glock. I'm not creative enough to make this shocks up. Okay, that's amazing. Like it's borderline dad joke. Glaucoma. Pediatrician here. A lot of parents come in thinking their child has cancer because they won't eat anything. Actually, they just don't like vegetables and are eating themselves to obesity with the crap you substituted with. Or the parents never learned how to properly cook vegetables and make them not taste like plain ass. I didn't like most vegetables until my sophomore year of high school because that was when I learned how to cook them myself and actually use, gasp, spices and shocks. When I was younger I never wanted to eat anything. My parents thought that I had mono, or just was being picky. I also had fatigue and fevers. Turns out I had cancer, leukemia, all, to be exact. I may have told this one before. Morbidly obese lady terrified she had a lump in her breast. Demanded to be examined immediately. Rib. Doctor, there's this lump on my breast, probably cancerous. What do we do, mom? That's a rib. Schizophrenic guy thought his lungs were rotting but it was okay because he'd just get a new torso from NASA. He's not even American. I don't know why NASA would give him said non-existent torso. Also, I'm not really sure what sort of official organization would give out torsos, but I'm not convinced a space agency would have been my first choice if asked. Psychologist here. Saw a leathery woman who drank 3 pots of coffee a day to cure her anxiety. Wish all problems were this easy to fix. My grandpa was drinking 6 pots of coffee a day in his late 40s and started having heart problems. It was skipping and he felt weird. Eventually the doctor got him to cut down to 1-2 pots a day. Fresh pots. Not a doctor, but a doctor diagnosed my wife with her STD. Chlamydia maybe. Huge fight. Wife was emotionally crushed. She accused me of cheating. Ducked up. I punched her symptoms into WebMD and told her it was probably kidney stones. Turned out to be kidney stones. Edit. Words. Thought that was going somewhere else about halfway through. She accused me of cheating. Ducked up. I punched her. That escalated at a relatively predictable and reasonable speed. No a doctor but a pharmacy technician. Had a patient yesterday tell me they went to urgent care and the nurse diagnosed pink eye. The patient didn't feel right about that and went to the eye doctor. Eye doctor told her she had an ulcer on her eye and if it went untreated properly she would lose eyesight and possibly the eye. I had a corneal ulcer once. Ate a few tiny holes in my eye. Worst pain I've ever felt in my life. Obligatory not a doctor, and it wasn't a self-diagnosis. My brother was acting really weird at my wedding, behaving like a jerk and his hands were shaking. He was my best man, so that made for some awkward interactions. He's also bipolar, so we all thought he was just off his meds, combined with a lack of sleep. It was a 10 AM wedding, and he was working nights at the time. 2 months later he was diagnosed with a brain tumor. I'm so sorry. Was it benign or operable? Did he survive? Had the same thing happen to a coworker. She had trouble completing sentences and would sometimes just stare off into space. Didn't think anything of it because she was a pothead. Turned out to be a brain tumor. She had it removed and is doing fine now. I know a girl who woke up one morning and felt pain in her abdomen. She thought she had gallstones and phoned the ambulance. Wind? She had trapped wind. I thought people only made these kind of mistakes in cartoons. TBF. Wind can be pretty damn painful. That can be extremely painful, and if it's never happened to her before, I don't blame her for being cautious. Not a doctor, but worked in a medical office. This is probably the opposite of what you were looking for, but we had a patient come in because he was having back pain. He figured he lifted something wrong working on his truck and the pain was just not going away on its own like it normally would. Turns out he had spinal cancer. He died about 2 months later. Similar story but with a happy ending. My employer's husband woke up one morning apparently paralyzed from the waist down. There was a tumor wrapped around the base of his spine. Lots of scary cancer treatments later. He's fine. He can walk again and has been cancer free for almost 10 years. This just happened to a friend of mine. She was told her back pain was because of having kids. She died on the 6th. As someone who's been to a doctor maybe twice in my 25 years being alive, I shouldn't be reading any of this. 28-year-old male who came in because he had a little pain in his testicles. He figured he caught it from his scrotum touching a toilet seat. On exam he had a scrotum that was the size of a grapefruit and extremely inflamed. Turned out it was epididymitis from 2 STDs. Worst part was that his mom and GF were in the room and he insisted they hear the diagnosis against our advice. We left to let him explain to them both how he contracted it from a toilet seat that also had a vagina. Edit. Grammar. How on world a 28Y man would have his mother and girlfriend go into the doctor office with him? Lindsay Lohan? Physiotherapist here. I had someone come in with shoulder pain and said they tore their labia. I think they meant labrum. But since they just came in to buy some exercise bands and weren't interested in an assessment, I didn't bother correcting them. I've been this person an embarrassing number of times. 1. Went in for hives. It was scabies. 2. Went in for a spider bite. It was a staph infection. 3. Went in for toxic shock syndrome. It was vertigo. Hey, I did the spider bite is really a staph infection thing too. Cheers. Edited to add, I thought it was just a spider bite, but when my sister saw it she made me go to the doctor. Turns out it was staph. Uncle is retired nephrologist. Favorite story was the woman who came to him and said she had fireballs of the Eucharist, which, correctly translated, were uterine fibroids. I get fibroids, but I am never going to call them that again. Fireballs of the Eucharist they are now. Too late. Now officially spending the rest of the day giggling over the idea of a church giving out communion wafers made from flamin' hot Cheetos. Someone came into our emergency dept reporting that their right eye was now square. It wasn't. They might have been schizophrenic. As a hypochondriac, duck this thread. Before I read this I thought I might have hemorrhoids, but now I know I'm going to die soon. Damn it. Thought I had a tapeworm once. Saw what looked like a foot-long worm in my stool. Decided to drive to the hospital first thing in the morning. That night I brushed my teeth, flossed, then dropped my dental floss into the toilet as I usually do before realizing I was panicking over a piece of string. I used to do that too. Ended up paying a plumber when he had to come snake out a bunch of caught up floss. Smiling face with squinting eyes. He looked at me like no one ever does that. Face with tears of joy. Not a doctor, but a patient. I came in one day with massive pain in my side, thinking it could be a kidney stone. After a CAT scan, I was told it wasn't a kidney stone because I didn't have one on that side. It turned out that I actually had a tiny tear in my intestine. The pain was my body trying to seal the hole. I was 22 when I learned I only had one kidney. Apparently some people go their whole lives without knowing. Yet True knew a neighbor who had found out late 20s of possessing only one kidney. He only found out because he got ill and they ran some tests which, not sure how, made them realize he had only one kidney. My mom was born with 3 kidneys. Obligatory, not a doctor, but my mom was losing weight and had lost her appetite for a long enough time for her to go to the doctor. She thought it was just a cold. Doc said it was a fever. Nope. Turned out to be leukemia. Fast forward 7 years later, all is fine. This doctor also thought my cousin's mono was just a cold. Why you keep going to this doctor? Time to change doctor. This is the flip side. But when I was a kid, my mom and I went to different orthodontists to see what my options were regarding the normal, overcrowding crossbite I had. This one female orthodontist suggested she remove 2 of my upper front teeth, then use braces to fill in all the gaps. My mouth had enough space to have it straightened out without removing any teeth. I went on to get regular braces and I was fine afterwards. What a ducking quack. Hope she lost her license by now. It's a racket. She pulls the teeth and puts them under her pillow. I thought I had an ear infection. It turned out to just be a glob of earwax sitting on my eardrum and causing all the discomfort, hearing loss, and pressure. Nice. Please smash the subscribe button to enjoy daily askreddit content. Work in a medical office. Mom brings 14-year-old kid in for a cold and shortness of breath. Turns out to be a spontaneously collapsed lung. Kid is admitted to the hospital and discharged. 2 days later, kid comes back into our office and what do you know? His lung had collapsed again. That was a fun report. Had a teenage girl come in because of strange bumps on her chest after she started a diet and lost some weight. They were her collarbones. He thought he had a cold. We found a giant pay. Not a doctor, and not a self-diagnosis, but a family member had some rectal bleeding ongoing with a history of hemorrhoids. His primary care doctor simply dismissed it as trouble with the hemorrhoids and to stay hydrated, and this too shall pass. A few days later he lands in the ER basically shock sting blood. Turns out he had diverticulitis. Was internally bleeding for nearly a week. Had to have his entire blood volume replaced twice via transfusions. Nearly died. And had to have a portion of his colon removed. Not a doctor, but a patient. Went to the doctor during the last big swine flu outbreak. The doctor didn't even check my vitals, just looked at me curled up on the table and said I had swine flu. Sent me home to quarantine myself and told me not to eat anything until I felt better. Went back a week later when my symptoms worsened and the lovely nurse had the genius idea to test me for strep. Yeah, it took one Q-tip up my nose to figure out the real problem.